This is a 55 years old male presenting with the history of severe right hypochondrial pain. Here what you are seeing is liver that is seen below costal margin, as I am giving a sweep to the probe from the epigastric region down up to the lumbar region. And here I see the kidney with the liver. Kidney is normal, and the liver is enlarged. It exceeds the lower pole of the right kidney. It is seen below costal margin. It exceeds the lower pole of the, this is the lower pole of the right kidney. There the liver is exceeding it, and liver has rounded angle, you see. And this is the left lobe of the liver. This is the aorta, and here is the IVC. We see both together. This is the aorta, this is the IVC, curved area, curved vessel. This is the left lobe of the liver, and if you see the left lobe of the liver, this is the left lobe in longitudinal section, and this is the left lobe in transverse section. Now what we are seeing is almost having similar appearance, echogenic rounded areas, multiple in almost all segments of the liver, as for example this one. If I say that this is the first one of the focal lesions surrounded by a halo. Halo is because of the compressed parenchymal, liver parenchymal tissue, and that is why we see a halo. So note the focal lesions, they are evenly echogenic, no posterior wall acoustic enhancement seen. We can see the posterior wall clearly, no calcification seen. See, only the size differs, otherwise the appearance of all these focal lesions is same, and they are seen in almost all the segments of the liver. None of the segment is spared. Outer surface is pretty regular. This is the right hemidiaphragm, and don't see any fluid above it. So these are focal lesions: 1, 2, 3, 4, 5, 6, 7, 8, 9. So similarly here in the left lobe of the liver, you see one. This is a focal lesion with halo around it. However, if you note one thing, that the outer surface in this region is smooth, the parenchymal echogenicity of the liver is normal, and there is no coarseness seen in this region. Vessel margins appear sharp. So the liver does not give a shape of that of cirrhotic liver. So this is not a cirrhotic liver. This is the left portal vein and the right portal vein together, as seen together. The right portal vein, the left portal vein, and this is the focal lesion in the left lobe of the liver in longitudinal section. Normal liver, normal outer surface, normal echogenicity, no coarseness, homogeneous texture, and we do see seeing in this region this is the IVC, this is the caudate lobe, ligamentum venosum, this is the portal vein, this is the portal vein, this is the common hepatic artery in transverse section, this is the IVC. Sorry, this is the IVC, and below it is the, now here we see this is the hepatic artery, portal vein, IVC, and this is the aorta. These are all metastatic lesions, diffuse metastatic liver disease. In a otherwise normal liver is not cirrhotic, except that the liver is enlarged. You don't see any finding, any other finding, except these globular echogenic areas that are all consistent with the metastatic lesions of variable sizes. The M denotes focal lesion. And are seen in all segments. This is the aorta. कोई ऑपरेशन से नहीं आया?
नहीं।
किसे
नहीं।
पासा ले आ जाए, बखी पढ़ने पासा ले आ जाए. So except this that the this is now with patient in left lateral decubitus posterior. See the focally. This is the focally, surrounded by a halo. Now this is the gallbladder. Excuse me, sorry. And we see this is the portal vein and this is the gallbladder. And you why it is gallbladder? Because we can see that the portal vein is at right angle to the neck of the gallbladder. Gallbladder is normal and clear. This is the focal vein. Let us focus on a single focal vein. Now this is a solitary focal vein surrounded by a halo around, and this is a typical case. Now it is evenly echogenic. If you see, echogenicity resembles that of the liver. Texture is though different. No posterior wall is accurately seen. No posterior wall acoustic enhancement is obviously. Kidneys are normal. Otherwise, we don't see any pathology. Siddhi ho jao. There is no evidence of intrahepatic bile duct ectasia. We do see a normal gallbladder. This is the gallbladder. This black tear-shaped area is a normal gallbladder. This is a magnified view through which I am showing you all this. So this is a case of diffuse metastatic liver disease. Thank you.